Our first technique is effleurage. Effleurage, as you will have seen from the information sent to you, is your primary movement. It's the introduction to the patient, your touch, which is going to communicate quite a few things. It needs to be confident and very clear in what you're going to be trying to achieve. It's also how you're going to put the oil onto your person. It's a linking movement, and it's also used when you can't think of what else to do and you effleurage while you decide what technique to use next. Effleurage can be applied very superficially, and you can use the same techniques applied with more pressure to have an effect on the deeper tissues. So to begin with, I am just using it to put the oil onto my treatment area. My stance is a lunge stance with the majority of my weight in my front leg. My back leg is fairly straight, and that acts more as the pushing point, and the front leg, knee, being more like a handbrake. As I let my weight move into my front leg, I keep my elbows straight, my shoulders down, my hands like an arrowhead, and I lean my weight gently into my front leg, which means my hands slide forwards. The distance between my arms and my body never changes. If you allow your elbows to bend, then you do lose some of the power that you've created in your movement. If you have your fingers facing at any other angles, you can put quite a lot of pressure on your wrists. So this is superficial effleurage. I can reinforce by putting one hand on top of the other and apply more pressure. And my towel is the indicator of where I stop, remembering that your towel techniques are the indicator of your treatment area. I avoid being mechanical. I'm following the line of the tissues, going longitudinally. Pressure is on the whole of my hand surface on the way up. I release the pressure but maintain skin contact as I return to my start position. Other effleurage movements are longitudinal. So finger stripping, fingers supported, sliding through is an effleurage movement. Thumb stripping with a single thumb on, reinforced, sliding through, is also an effleurage movement. The broader the contact area, the less intense for the patient. The smaller the contact area, the less you have to apply pressure, but the more detailed your treatment can become. Move from superficial to reinforced, beginning to feel the temperature changes, slowly applying greater and greater pressure, and checking with your patient the amount of pressure using a pain scale check of 1 to 10. 1 being nothing, 10 being very painful. At the moment, I would expect an effleurage to be around about a 2 or a 3. It's a warm-up technique. I can also use forearm as a stripping technique. It is easier for me, but requires more control from you. And I can use elbow to rest my fingers and my wrists, which is what the majority of sports massage becomes. The deeper the technique, you'll notice the slower I'm actually moving. I also have 1,000 hands, a very quick and light technique that warms the tissues very rapidly, which I can intersperse with my other techniques, always moving, driving my treatment from my legs. To recap, superficial, reinforced, finger stripping, thumb stripping, forearm stripping, shoulder over the elbow, leaning into it, and elbow, using your other hand as the guide to make sure you don't slide off. And use effleurage at the end of any deep tissue work to relax the tissues and stimulate the circulation.